We like to know what to expect. We like the world to feel predictable. Now, in COVID-19, that is all turned on its head.
Chaos at the airports, gridlock as American passengers...
I think that in many ways this pandemic is just the perfect storm.
And then we start to, go over that event horizon into the black hole of anxiety.
The pandemic of fear is as dangerous as the pandemic of disease.
But there is no need to panic.
The COVID-19 pandemic is more than a story about a severe acute respiratory syndrome. It's a story about us and about the ways that this global event is changing our minds, our relationships, and our communities. My name is David Condos, and I'm piecing together the facets of this story with some of today's leading mental health experts.
My name is Dr. Judd Brewer.
Tian, Dayton.
Karestan, Keonen.
My name is Yolo, Akili Robinson.
Farha, Abbasi.
Dr. Claudia Black.
I'm Peter Levine.
People who are on the front lines of research, education, and treatment around the world.
King's College London.
At Mental Health America.
At the University of Toronto.
I'm one of the senior fellows at Meadows Behavioral Health.
The Harvard T.H. Chan School of Public Health.
The Stanford University School of Medicine.
Liverpool John Moores University in the United Kingdom.
This pandemic season has brought us face to face with some big questions. Questions about life, about death, and about what living through this type of crisis does to our brains.
It's an ongoing trauma without an end in sight.
Trauma has a heritable component, and we may be picking apart the epigenetic effects of this for the next century.
How is the pandemic changing the way we view the world?
It's wired into us. It's not some psychological phenomena. We are wired to need and to respond to close physical contact.
And unfortunately, right now, connecting with our fellow humans also happens to be the greatest source of threat.
That makes it more complicated to support others because we're simultaneously trying to support ourselves.
How is this crisis inflicting new trauma and exacerbating old wounds?
When you go to a place where there's trauma, show up, shut up, and listen. Listen to their story.
For most communities of color, when the world gets a cold, we get the flu.
What are the traumas that have occurred in the past and how are they affecting the present?
And in the midst of all this, how can we begin to heal?
So I'm one of the people who said this could be a mental health disaster, but that doesn't mean it will be.
The trite phrase of we're all in this together, that is, I think, the number one lesson.
I just want people to know that it is okay for them not to be okay. It's just not okay for them to sit in silence and not get help.
This is In Practice, the story of the other pandemic, the one that's happening between our ears. Join me as I explore the answers to these questions and more in this new podcast brought to you by Meadows Behavioral Healthcare. Subscribe now wherever you listen to podcasts, and let me know what questions you have at inpracticepodcast.org.